Good afternoon, everyone. Thanks for joining us for the September edition of our Benefits Lunch Break series. I am joined with my colleague, Alex Dombrow, today, who's going to be leading this. As you'll see in a minute, we will be talking about impacts on group health plans under the Inflation Reduction Act, which was recently signed into law. Just to give you a heads up, we have for those of you that have joined us, we do these lunch break webinars every Wednesday, the third Wednesday of every month, at 12 p.m. Eastern time. So the next ones are slotted for October 19, November 16, and December 21. To give you a heads up, the December 21 will probably be the entire group again together like we did last year, and it will be like a question and answer type seminar. So we won't necessarily have any prepared material, but we will solicit questions in advance and of course be taking questions that you guys submit live. Again, we seem to have had a lot of material to cover over the past 2 years that we've been doing the webinars. But to the extent that we run out, we would love to hear what you guys would like to see. So you can either do that in the question and answer feature or in the post-webinar seminar. And keep in mind, in the chat feature, the Q&A feature, we will be taking live questions to the extent that we have time. So feel free to, if you have any questions about today's webinar, feel free to submit those through the Q&A feature. With that, I will pass it over to Alex. I should introduce Alex. Alex is a new associate at Miller Johnson, joined in May, and he has been studying up on this Inflation Reduction Act and is going to take you through today's presentation. Take it away, Alex.
Hi, good afternoon, everybody. As Tripp mentioned, my name is Alex Dombrow, and I'm a new associate here at Miller Johnson. Now, today we are going to be talking about the considerations for group health plan sponsors that are found in the recently passed Inflation Reduction Act. This next slide here is just some legal disclaimers. I'm sure most of you have seen these before. We are not giving any formal legal advice. This is just informational purposes only. So a quick overview of the Inflation Reduction Act. This piece of legislation was signed into law by President Biden on August 16th, 2022, and makes several changes that indirectly impact employer-sponsored group health plans. We've divided these impacts into 5 separate discussion categories, and we will start going through those now. So the first change made by the Inflation Reduction Act that will most likely have an impact on most group health plan sponsors is this new safe harbor to cover any type of insulin and any dose under a high deductible health plan before a participant reaches their deductible. Now, generally how high deductible health plans work is that, in fact, the plan cannot cover anything before a participant meets their deductible, with the exception of preventative care services. So what the Inflation Reduction Act does is adds a second safe harbor exception here that says a plan will not be disqualified from having their health savings account if they cover insulin products, even if an individual is not diagnosed with diabetes yet. Some of you may remember back in 2019, Health and Human Services issued some guidance that allowed for certain types of insulin to be covered pre-deductible if there was a diagnosis of diabetes. What the Inflation Reduction Act is doing here is codifying most of what Health and Human Services was saying in 2019 and adding in that there is no necessary diagnosis of diabetes before insulin can be covered under these plans pre-deductible. Now, one clarification here is that this is not a mandatory thing. The Inflation Reduction Act is simply saying that if you would like to offer some sort of coverage for insulin before a deductible is met, whether that be full coverage or a percentage, you can offer that to your participants, but you are not required to do so.
Hey, Alex, I just want to highlight that again, because unlike some of the ACA preventive care services that group health plans are required to cover on a first dollar basis, this insulin is not a requirement. So employers aren't required to cover insulin before the before the deductible. But if a high deductible health plan, if a sponsor of a high deductible health plan chooses to do so, we don't have any HSA eligibility issues, correct?
Correct.
All right.
All right.
I just wanted to highlight, you got that, but I just wanted to highlight because that was a big question I had as we talked about earlier this week.
Sure. And that is correct. It is not required to be covered, but something that could be offered to participants. So moving on to the next slide here, the second major change made by the Inflation Reduction Act is the extension of the Enhanced Affordable Care Act premium tax credits. So in 2021, nearing the end of the COVID-19 pandemic, the American Rescue Plan Act was passed. And what that act did was said that premium tax credits could be offered to individuals with incomes over 400% of the poverty line. That rule was set to expire December 31st of this year, and the Inflation Reduction Act went ahead and extended those increased premium tax credit levels through the end of 2025. Since an employee's eligibility for a premium tax credit under the ACA is generally the trigger for a penalty to an employer who sponsors a health plan, applicable large employer, so that's an employer with 50 or more employees. The big thing to take away here is that there is some increased exposure to penalties moving through 2025 as potentially more individuals under your plan may qualify for a premium tax credit.
Hey, Alex, I'm going to jump in there right now, if you wouldn't mind going back to that slide.
Yep.
Yeah, and this is not going to, for those employers that are out there that are applicable large employers that are offering minimum essential coverage that's affordable, this really isn't going to be an issue for you folks. But if you are not offering coverage to some of your what we call ACA full-time employees, or that coverage is potentially not affordable or not of minimum value, you may have that's where the additional exposure lies, right? Because some of those employees where, if they were above the 400% of the poverty level, wouldn't get the premium tax credit and therefore wouldn't trigger the penalty. Now that may occur. But again, if you're offering affordable minimum value coverage to all your full-time employees, you really don't have to pay too much attention to this.
Okay, now on to the provision of the Inflation Reduction Act that a lot of you have probably been hearing about in the news lately. And that is this new program for Health and Human Services to begin negotiating drug prices on behalf of Medicare. So this is a pretty new and novel idea. Before the Inflation Reduction Act's passage, Medicare and Health and Human Services were actually barred from directly negotiating drug prices with manufacturers. And this does a total 180 and says, in fact, now beginning in 2026, Health and Human Services is required to go to drug manufacturers and begin negotiating down prices. So how this will work is on the next slide here. And beginning in 2023, the Director of Health and Human Services and the employees in that department will begin putting together a list of the most expensive drugs paid for under Medicare Part B and Part D. Each year, this list will have 50 drugs on it. And to qualify, to be on the list, these drugs must be FDA approved for at least 7 years, or if they are a biologic, licensed for 11 years. And starting in 2026, Health and Human Services will go to these drug manufacturers and negotiate the top 10 most expensive drugs the first year. And then the next 2 years, they will negotiate the price down of 15 different drugs, and in 2029, 20 different drugs. One thing to note here is that the first 2 years will apply only to Medicare Part D drugs. So the big issue here that we have been noticing for employer group health plans is that there are no protections in this provision for you. All of these price negotiations will apply only to Medicare Part D and Part B plans. So there's nothing in the Inflation Reduction Act that will prevent a manufacturer from attempting to recoup their losses from the private sector, i.e., employer-sponsored plans. Now, one thing we've been seeing from the budget office is that they're expecting this to save Medicare about $100 billion over the next 10 years. And another way to read that is that manufacturers will be losing that same amount of money. So we just wanted to kind of hit the highlight that it is highly likely that, especially beginning in 2026, when these reduced negotiated prices start to hit the manufacturers, it is likely that they will turn to the private sector and increase prices on these 50, these 10 drugs in 2026, 15, 2027, and 2028 from the private sector. And unfortunately, we will probably see drug prices for employer-sponsored plans increase in the near future.
But Alex, it didn't make it into the bill, but they did try to set caps on some of these drugs that therefore would have given the benefit to employer plans.
Correct. Yes, in the original
legislation, correct. But that certainly could be something that's on the table yet in the next couple of years because of the fear that, obviously, for those of you on the line that are familiar with your employer plan, some of the biggest spend these days are prescription drugs. And so this is not an issue that's going away. So again, I don't have a crystal ball, but I don't think protections for employer-based plans are totally off the table, but that's something that we will continue to monitor.
Absolutely. On to the next slide here, and this ties into the Medicare price negotiations we just spoke of. There are additional savings for Medicare Part B and Part D plans built into the Inflation Reduction Act. So beginning January of 2023, what the act designates is that manufacturers can no longer increase their drug prices at a rate higher than inflation for Medicare Part B, and then in October of that same year, also for Medicare Part D drugs. So what will happen here is if a manufacturer is drastically increasing prices year after year, and that is outpacing inflation based on the consumer price index, the manufacturer will have to pay a rebate to Medicare Part B or Part D at the rate of about 125% of that price difference for each drug. Once again, a big thing to note here is that there are no protections, no sharing in the rebates for employer-sponsored plans. However, like Tripp mentioned earlier, this is another area where legislation may be passed in the next few years to protect employer plans and pass these rebates onto them as well. But as of now, that is not in the bill, and something to look out for that may increase drug prices for employer-sponsored plans, at least until additional legislation puts protections in place for the private sector.
And I want to interject one thing. Keep in mind that under the Consolidated Appropriations Act, fiduciaries of employer plans now have a requirement to at least request some transparency compensation, indirect compensation disclosures from their vendors or service providers. PBMs are loath to give up to disclose what these rebates are. But we're starting to see a push here. So keep in mind that even though we may not have these benefit from these rebates, employer PBMs and TPAs often will get rebates, and we really need to start pushing on them to disclose what those rebates are. So there is some hope that maybe some transparency there will assist in lowering the price as well.
Absolutely, and we will actually touch on the PBM rebate system toward the end of this presentation. But moving along here for now to Medicare changes that are included within the Inflation Reduction Act. So the IRA makes two major changes to Medicare Part D in beginning in 2023. The first one being a cap on spending for Part D participants for insulin. So there's actually quite a few things that we've seen so far have touched on insulin in this Inflation Reduction Act, this being one of them, where beginning in 2023, it'll be capped at a $35 monthly charge for all insulin services that are needed by a beneficiary. Thing to note here is if a plan has an employee group waiver program or a Medicare Advantage plan, this may pass some costs along to that plan as well. Somebody's going to have to pay for the difference in cost here, assuming the manufacturers are not just going to give up their profits. And that's either going to be Medicare itself or a Medicare Advantage plan. Additionally, beginning in 2024, Medicare is going to restructure its financial liability. So as of right now, a Medicare Part D participant will pay all of their prescription drug cost up to what is called the catastrophic threshold. For 2022, that was just over $7,000 for a participant. After that threshold is hit, a participant pays a 5% cost sharing portion of drugs through the end of that plan year. So in 2024, that 5% cost sharing is going away. So now, like with the $35 cap on insulin, individuals who maintain any sort of Medicare Advantage plan will be absorbing that 5% cost. Beginning in 2025, the IRA goes a step further and actually effectively caps that catastrophic threshold at $2,000 per participant. So in 2025, an individual on Medicare Part D will pay no more than $2,000 out of pocket for drugs. After that, 80% will be paid by Medicare, 20% by a Part D plan. And just another note there, as with every other part of this bill, that you'll see that no protections were offered to non-Medicare individuals in either of those contexts. Additional Medicare changes will include some issues surrounding vaccines. So beginning January 1st of 2023, Medicare Part D will no longer impose cost sharing on vaccines for adults that are recommended by the Advisory Committee on Immunization Practices. And beginning in October of 2023 as well, those cost sharing protections will be passed on to most individuals under Medicaid and CHIP, which is the Children's Health Care protections, usually offered on a state-to-state basis. They change slightly from state to state, but generally any individuals covered under those state laws will also have vaccines free of charge.
Hey, and Alex, I just want to point out that that change was probably largely driven with the COVID vaccines. So as we know, COVID vaccines were free of charge for anybody. And even if you didn't have health insurance, and then the provider was not allowed to charge you anything because they would end up billing the federal government. So this kind of brings Medicare, Medicaid, CHIP all within the same, same protections as people that have private insurance, that they will no longer be paying for vaccines that are recommended by the ACIP.
Yes, for sure. And, this is another thing here where we could see it may not be off the table, especially under the current administration, where this may be passed on and a requirement for employer group health plans in the future as well. But as of now, just applies to Medicare, Medicaid, and CHIP.
Well, let me just point out that most ACIP recommendations are required to be covered by private insurance under the ACA. Remember, if it's got that recommendation, it's a preventive care service. So a lot of vaccines fall within that. Not all of them, but just wanted to highlight that.
Sure. All right, and moving on here, we touched on this a few slides ago. So coming back full circle on this last slide here, the Inflation Reduction Act also delays the Trump administration's pharmacy benefit manager rebate rule. So if you all on the call remember back in early 2020, the Trump administration finalized a rule that said there is no more safe harbor for kickbacks received from PBMs or Part D plans that negotiate rebates for certain drugs. So this rule has been delayed till 2027. So the status quo will be maintained here, where the pharmacy benefit managers, Part D plans, any entity that negotiates rebates for their drugs can keep those rebates themselves and hopefully pass along cost savings to the individuals within the plan. As Tripp mentioned earlier, this is important because we have those transparency rules in the Consolidated Appropriations Act that will allow plans to request information on rebates and the actual price of drugs that are being paid by PBMs in the plan.
If you have any questions that come up later, feel free to reach out to either Alex or myself. You can see our contact information on the screen. We appreciate it and hope you have a great month. And please join us again here in October when we have our next benefit lunch break series. Thanks.
Absolutely. Thank you, everyone, for the opportunity to introduce myself, and look forward to working with you in the future.